The next procedure we're going to talk about is the gastric bypass. This is considered the gold standard operation and historically has been done more than any other weight loss surgery. It has been around since the 1960s, so we have studied it extensively and have followed patients for over 20 years. What we do with this operation is that we make a small pouch out of the upper portion of the stomach. Your stomach is usually about the size of a football, and we now make it into about the size of an egg. We then divide your intestines down below and connect it to that pouch. All the food that you eat will now go down your esophagus, your swallowing tube, into the pouch and then directly into the intestines. We also make one other connection down below to rehook the intestines back together. The old stomach is not removed. It still makes digestive juices that mix with bile and pancreatic juice to go on and absorb your food downstream. We do not bypass very much intestine at all, and the majority of your intestine is left intact. This allows for the absorption of most all vitamins and nutrients, as well as all medicines, antibiotics, etc. There are a few vitamins and minerals that are affected with the gastric bypass, and so it becomes very important that if you get this surgery that you get on supplementation. These surgeries require you to be on multivitamins, B12, as well as calcium. We will be testing for other things annually to make sure that your iron, vitamin D, and other levels are appropriate. This is a combination procedure. There is some malabsorption as well as dumping syndrome involved. The gastric bypass has a tremendous amount of advantages. Since we've been doing the surgery since the 1960s, we know the most about it, and we know what vitamins need to be followed and what kind of complications could arise. It gets the weight off very rapidly. In general, you're going to lose approximately 70% of your excess weight during that first year. Most of that weight comes off the first 6 months. This allows for very rapid resolution of your health issues. You're able to come off your diabetic medicines or get rid of your CPAP machine much earlier with this operation than you are with some of the other ones. This operation works particularly well for patients that are diabetics. There is no better operation for curing diabetes than the gastric bypass surgery. The other health issue that it works really well in is reflux. People that have gastroesophageal reflux, this is almost a 100% cure for that procedure. This was a study done on over 22,000 gastric bypass patients. And I think it's one of the most important slides we show because it shows how much just losing weight improves your health. Patients who underwent the gastric bypass on average resolved or improved their diabetes 86% of the time and had complete resolution almost 77% of the time. High cholesterol improved 60%, high blood pressure improved over 60%, sleep apnea 85%. This is a very short list of some of the benefits you get from the surgery. Just losing the weight improves your health so dramatically. I always tell people if I had a medicine I could give to every diabetic and it would cure their diabetes 80% of the time, I'd have the Nobel Prize for medicine and I'd be a billionaire. I have a surgery that offers this and so much more. Just losing weight, look how much better your health gets and look how much better your life can get. There are some known risks with the gastric bypass. Because you're dividing the intestines and making connections, you could develop a leak, which is not enough scar tissue forming at that site. We will test for that in the operating room and make sure you do not have a leak when you leave. You could also develop too much scar tissue, which would be a stricture. Other risks associated with the gastric bypass would be twisting of the intestines. This is a rare complication, but is known with the surgery.